This segment is brought to you in part by UnitedHealthcare.
The United Health Foundation just released America's Health Rankings 2022 annual report. It highlights improvements, challenges, and disparities in the health and well-being of Americans across all 50 states. New York ranked 23rd this year. Joining us from UnitedHealthcare is Dr. Rhonda Randall. She will tell us about these findings. It's always great to see you, Dr. Randall.
Thank you for having me.
So what is the most notable finding in this year's report?
Well, this year's report gives us a more comprehensive view of what occurred between 2019 and 2020. This report contains 80 measures of our health, and the most staggering finding, the most disappointing finding, is that just in the last year, drug deaths in our nation have increased 30% nationally. That means 91,000 confirmed drug overdoses in the United States, and about 3 out of every 4 of them was related to an opioid.
Oh my gosh, that is sad to hear at the very least. But what can we do as a community to help?
That's a really good question. The first is, in an emergency situation, the use of naloxone, which is a generic name, is an opioid antagonist. You want to make sure that you have access to that medication and can get somebody to the hospital quite quickly. But the mainstay of treatment for opioid use disorder is medication-assisted treatment. It's a combination of use of medications as well as counseling and behavioral therapies. Making access to that, understanding where to get that support, and helping a loved one get to it is very important at a community level.
So what were some of the other significant findings in the report?
Well, there were some bright spots in this report. Here's good news. We have more individuals who are choosing careers as licensed mental health professionals, as well as in primary care. The supply of mental health providers increased 7% in our country, and primary care increased 5%. Another positive measure was the increase in high-speed internet access. We foreshadowed that that was likely to happen, and it did during the pandemic. It increased 3% nationally, meaning 3 million additional people have access now to high-speed internet access and a device connected to use it with.
Can we turn our focus now to New York? When it comes to New Yorkers, what were some of the things that you highlighted?
So in New York, we saw a mortality rate increase 31% between 2019 and 2020. That was a very significant increase, and it's primarily responsible for New York moving down in the rankings this year from previously 11 in 2018 to now 23 in 2022. We also see that obesity is on the rise in New York. Some good news, though: excessive drinking went down, and a lower prevalence of frequent mental distress in New York than the rest of the nation.
So what are New Yorkers' biggest strengths and challenges?
From a strengths perspective, a low rate of uninsured, also a low prevalence of people who have multiple chronic conditions. New Yorkers are high in the rankings on getting fruit and vegetable consumption. From a challenges perspective, continues to be an issue with high income inequality, high rates of residential segregation between blacks and whites, and a high percentage of households who have experiencing severe housing problems.
So what can be done to improve the nation's health?
Well, we really want to encourage policymakers and healthcare professionals to look at this report, look at the data. The conversation around the opioid crisis is a very important one right now. All of this information is on our website. It's americashealthrankings.org.
Fantastic. It is always great to see you. Thank you for all of that wonderful information. Happy holidays.
Thank you. You too. Be well.